Some patients may not have satisfactory control of their asthma. One of the underlying reasons is because they do not know how to use their inhalers properly. My name is Malin Tiu, and I am a pharmacist. Today, we will be discussing about the proper use of this kind of inhaler. This is a medical device, and we call it Turbuhaler. This is a dry powder inhaler, frequently prescribed medication for asthma or COPD. This one that I am holding contains two medications inside. A corticosteroid, which is an anti-inflammatory drug. It controls airway inflammation. And the second drug here is a long-acting bronchodilator that opens up the airway and keeps it open for about 12 hours. That is the reason why it is usually prescribed twice a day. It is important for you to follow doctor's instructions whether to do it twice a day, because there are times when the doctor sees it fit to give it only once a day. This inhaler, which is a combination of the two medicines that I told you about, is used as a controller rather than a reliever. Controller rather than rescuer. So if you have an acute asthma attack, you have difficulty breathing already, do not use this. Rather, use this. This is for your everyday use, whether or not you have an asthma attack, you have to do this already every day. This one is maintenance, do it every day. This one is only as needed if you are having an acute asthma episode. If you are using a new inhaler, make sure that you prime it before your first dose. How do you prime it? You just twist it once. That's primed already. That is to make sure that it is working properly. This is how we open it. Just twist away from you. This is you, twist away from you. And then this one is open already. Now you have a wheel here. You twist it, going away from you first, all the way. And then you twist it towards you until you hear a click. Can you see it? This one is your dose counter. It will tell you how many doses you have already. If you only have 10 doses left, be sure to get your refill already. Do not wait until it reaches 0 before you buy your next inhaler. So this one here is the mouthpiece. And then there are holes here. There is a hole here. So make sure you don't cover all of these holes, because this is where the air flows in to make sure that it delivers the proper dose. You don't shake this. It has to be upright. Don't do it like that. Don't shake it. Don't do it like this. It has to be upright. The reason for that is because our drug is a powder. It is a dry powder. We would want the powder to settle so that when you load the dose, you load it like this, twist, and then twist back until you hear the click. When you do that, a certain amount of dose will come down. That will be one dose. So if you do it like that, the powder will not be giving you the exact dose. The dry powder inhaler do not contain a propellant. So how are we going to get that powdered drug into our lungs? We use our inhalation. The force of our inhalation will bring the powder down. How are we going to put the mouthpiece into our mouth. This is how we do this, okay? Put this one inside your mouth. Your lips should cover the mouthpiece completely, like this. Do not bite on the mouthpiece. And your tongue should not cover the mouthpiece. It should not cover your throat. Next, breathing. Remember that the medicine here is dry powder and there is no propellant. So when we inhale, the inhaling technique here is very specific to dry powder inhalers, which is inhaling the drug in quick, forceful, deep breath, okay? Quick, not slow, but it has to be, okay? Forceful. Make sure that you imagine that you want to mobilize the powder into your airway. So forceful and then deep. Imagine that you want to bring the powder into your lungs. This does not contain any drug, so I can do this. Okay. Quick, forceful, deep. Okay. So when you are ready, this one you put away from you and then you breathe out. Bring this here like that. This one has to be horizontal. Quick, forceful, deep. After you do that, don't open your mouth, okay? Just close your mouth and then wait for 10 seconds or so. If you can hold it for 10 seconds, good. If you cannot hold it for 10 seconds, it's okay, as long as you hold your breath. The reason why we want to hold our breath is because we want all the powder to go down into our lungs. If you're going to do it slow, then maybe you cannot draw the powder out from the inhaler. Or if ever that you are able to draw the powder, it will just stay in the mouth. We don't want the powder to stay in the mouth. We want the powder to go into the airway and then on to our lungs. After that, we breathe out. Don't breathe into here because our breath has moisture. Then we don't want moisture to go inside because it might wet the powder. Once the powder is wet, everything is ruined. You can't use this anymore. Close it. Remember I said that this medicine contains a combination of a corticosteroid and a bronchodilator. If you use any inhaler that contains corticosteroid, you have to wash your mouth, gargle, and then spit it out because we don't want the corticosteroid powder to stay in our mouth or in our throat because it may cause thrush infection in the mouth. So let's do it again. Remember, you don't shake, it's always upright. and then you wash. Gargle. Spit it out. You clean the mouthpiece with dry towel. Do not use wet tissue paper or wet towel, and do not wash this with water. Again, the reason for that is because this contains dry powder and we don't want that powder to get wet. If you have any question about your Turbuhaler or dry powder inhaler, do not hesitate to ask your doctor or your pharmacist. So I hope now you know the proper technique of using your Turbuhaler. If you know someone using this, you can teach them or you can let them watch this video. If you are using this kind of inhaler, we have another video for the proper way of using this. Please subscribe, write your comments, ask questions, because we will have other videos coming up.